All right, I am recording. This is third video in our series of video six assignment. In this video, Dr. Slime has requested an SBT, so go through all the things dealing with that. All right, so number one, describe the type of SBT. We will be putting her on spontaneous mode on this Puritan Bennett or CPAP. Pressure support of 5, PEEP of 5. Use that pressure support to decrease that work of breathing. Probably keep her FiO2 the same. I think he had it at 35%, so we'll just keep it there and see how she does. Hopefully she passes. Um, what to do to prepare for her for a successful SBT. We're gonna stop the paralytics and sedations. Make sure there's a reversal of the underlying cause. Um, Adequate oxygenation, PF ratio greater than or equal to 150 to 200. Uh, PEEP less than equal to 5 to 8. And then the FiO2 40 to 50%. Want to make sure that heart rate's greater than 50, less than 130, temperature less than 38 degrees Celsius. And then that pH, we want that above 7.25. Making sure she has a cough gag reflex, hemodynamic stability, and then just the ability to initiate inspiration effort on her own, right? Um, so assessments that we'll use to know that she passed. Well, we'll make sure she's pulling good tidal volumes, minute ventilation uh, in the normal range. The SBI, less than 100. Vital capacity, at least a liter. A good NIF, greater than negative 20. So, for instance, negative 60 would be way better than negative 10. Looking at her, vital signs, her respiratory rate, heart rate, blood pressure, SpO2, making sure all that is normal. And then also we want to grab a good ABG and see, making sure those numbers are at her baseline before we pull out this tube. And then, we want to check our patient's alertness, responsiveness. Is she able to follow commands, squeeze our fingers? Does she know where she's at, what year it is? All those good things. So signs of failure. Uh, in this case, we would definitely discontinue and return to mechanical ventilation. Having a respiratory rate greater than 35 for at least 5 minutes. Looking at her blood pressure, if her systolic decreases or increases, more than 20 torr. Looking at the diastolic, same thing, except if it increases or decreases more than 10 torr. Looking at her heart rate, if there's a increase or decrease of greater than 20 beats per minute from baseline, or if it's greater than 130 or less than 60, I'm discontinue. Also, her SpO2 below 90%, but in her case, 4% from her baseline, since she's a COPDer, and then pH less than 7.30. And also, if she's just agitated and her anxiety, just all those things are increasing, might not be time to pull that tube yet. All right, so now I'm gonna explain that SBT to her. All right, Miss Tuesday, we want to get this tube out of you, but in order for me to tell the doctor we're ready to do that, I need you to, what I'm gonna do here is I'm gonna switch the modes on the vent to where you're gonna be doing all the breathing and all the work, okay? And I'll be right here monitoring, capturing some numbers, and then what I need from you, and then I would also get daughter if she wants to come over here and help me encourage her to breathe. So what I need from you, Miss Tuesday, if you want to just take nice deep breaths, nice and easy, and just try to breathe on your own. Nice deep breaths, the best you can do, okay? And then I'm gonna be over here monitoring the vent, grabbing some numbers, reporting back to the doctor and letting them know what I got, and hopefully we're able to get this tube out, okay? All right, and then normal weaning parameters I'd expect. Like I said, that minute ventilation, 5 to 10, based on her kilograms. Respiratory rate below 30 to 35. Hopefully she's pulling good tidal volumes, at least 5 milliliters of kilograms. That, like I said, vital capacity at least a liter. NIF, MIP at least -20 or greater. RSBI less than 100. SpO2 and around her baseline. And then making sure her signs and symptoms are absent. So hopefully we get those and we can pull this tube out. All right, Miss, and now I'm gonna explain how to get that vital capacity and that NIF from her. All right, Miss Tuesday, remember how I said I need to get some numbers? So what I need you to do now is I want you to take a big, deep breath in, as big as you can, and then I want you to let it all the way out. Okay? And that's going to be me measuring her vital capacity. And what I'm going to do is I'm going to wait and synchronize it with her chest rise and fall. So I don't want to tell her when she's already inhaling to take a bigger deep breath. Wait till she exhaling and then start again that next inhalation. And then same thing for NIF. I want to wait, watch her chest rise, look at her waveforms, and wait for her to be ready to take that inspiratory breath. And then for the NIF, same thing. I would hit the button, special procedures on the or special maneuvers on the vent. Got the NIF button, and then tell her, all right, I need you to take a big, big, deep breath, as big as you can. Hold the button, and it'll record our NIF. Hopefully, reads over 20% or -20. All right, and then next, what her normal values would be. So she is 5'4", so that would be 54.7 kilograms. Her normal tidal volume range is going to be 328 to 437. Normal respiratory rate at 12 to 20. And like her minute ventilation, 5 to 10, like we explained earlier. Uh, I just made some parameters that we would, some good parameters that we would get. So from her values for her RSBI, I got 45. Vital capacity is over a liter. Her NIF's -30. SpO2 is holding at 92%, and then end titles reading 50%. So we are looking good. And then also looking at her ABG, uh normal for her. It's gonna be the, that COPD range. So 7.34 to 7.37, CO2, 55 to 65. Same thing for that O2. And then the bicarb, 28 to 30, 34. So we got an ABG within those ranges. So everything's looking good so we can pull this tube, and that'll be the end of this video. Thank you.